Hey, I want to talk a little bit about long needles. So long needles sometimes are hard to get in tissue because they're freaking long, right? I mean, good God, look at that. This is a 105. This is a 100. This is a 125. It's just a long needle. It's obviously a longer needle than I need for this guy's butt, but I wanted to do a demonstration about it anyway. So sometimes with a long needle, when you go to tap the needle in, it starts to get real wispy and it starts moving around, and you can't really get the needle in. So let me demonstrate that for you. Are you freaking out because this needle's so long? Yeah, you're freaking out. Look at that. It is pretty freaking long there. All right, so if you went to push this needle in, what would happen is, see how it's just bending everywhere? Like you can't even get that thing in the tissue because it's bending so much. And what you would be tempted to do is grab it like this and be like, okay, I'll show you. I'll get you down in there. Ah, there we go. See? But look what I've done. I've contaminated the needle because these gloves aren't sterile. So that's not good. So I would not want to push this into the tissue because this needle has now been contaminated with my non-sterile hand. So that makes it a, freaking bad needle. Yeah. So what you can do is you can do something to help you a little bit. Not that one. Let's do this one. So if you have a long needle that you have trouble getting in, you can open a smaller needle and use the guide tube of the smaller needle to help you get it in. So I'm going to take this needle out and I'll put that in the surf container. I'll leave that there. And then, still, if this needle is long and I was having trouble getting it in, what I can do is take my guide tube, slide it over this needle, then I can hang on to the guide tube, and then I can push this needle down into his skin without contaminating the needle, right? So that's just a little trick. Of course, you have to waste a needle to do that. All right, another option if you don't want to waste a guide tube, to take the guide tube off of another needle and slide it over a longer needle, is you can use a little bit of alcohol. So let's say that you have trouble getting this needle in. What you can do is take an alcohol wipe, open it up, and then grab the needle with the alcohol wipe, and then hold onto the needle with the alcohol wipe, and then you can push the needle down through the alcohol wipe to give you the control that you need over that longer needle without contaminating the needle. Now, another thing you can do is APS invented a needle called a safety tube needle. With a safety tube needle, it's a needle that has 2 guide tubes on it. So for this particular needle, again, skin's already wiped down, so we're still good. You have 2 guide tubes. So this pink guide tube, you would just slide it down, and then you pop your needle in, you hang on to your pink guide tube, you pull off this long guide tube, and then you're still holding your pink guide tube, and then you can use that to push the needle down into the glute. And then you pull off your pink guide tube, and then you're good to go, and you never contaminated the needle. That was a 100mm needle in your butt, wasn't it?
Really?
Yeah, did you like it?
Not really.
Not really. No. Anyway, that's just a couple tricks to help you get a longer needle into the butt. You can use a smaller needle with guide tube, slide it over the top of the needle, or you can get these safety tube needles that have 2 guide tubes. Just some helpful little tips.